understanding why a joint has lost range of motion is really, really important. It informs the diagnosis, which therefore informs the type of treatment that will be applied. So let's talk about different reasons joints are not moving well in the neck specifically. When I think of why a joint isn't moving, I break it down into three main categories, the third being something you hardly ever see. One, there's tissue restriction. We're usually talking about muscles and tendons, but we could also be talking about fascia, or even more superficially, skin, and more globally, capsular tightness. Secondly, there can be joint obstruction. I argue this is by far the leading cause of loss of joint range of motion. And then thirdly, maybe a joint's not moving well because of pain, fear, apprehension. That's when the clinician observes passively that the movement seems like it could keep going, but the patient says to stop, and we call that an empty end feel. And that's quite rare. All three of these categories, of course, have subdivisions or root causes within them as to why there's tissue restriction, why there's joint obstruction, and why there's an empty end feel. Like I said, I think most problems are joints being obstructed, but this kind of paradigm is not really taught to us. At least it wasn't taught to me. And so most clinicians and almost all patients believe that they have lost range of motion because something is physically tight. There's a tight hamstring muscle. There is a tight pec muscle. There is something that's causing that shoulder or that knee or that hip to lose range of motion, and it's because a muscle usually has gotten tight. And I don't find that. So if we think about the neck, if I have, let's not go through all the rules of what would make something a viable presentation for tissue restriction versus joint obstruction, but let's do some superficial talking about this. If my pain is on the right side and I can't go all the way to the left, that could be tissue restriction because the pain is in the muscle where the tissue is restricted, and I'm lacking motion, or I'm producing that feeling when I bend to the left, and those muscles on the right side of my neck are on stretch. This presentation, however, if just that range of motion were lost, could also be joint obstruction. When we talk about joint obstruction, I'm thinking that something inside that joint, inside the mechanical unit of a joint, is not moving well. In the spine, we could think about the nucleus and the annulus of the disc, something kind of deranged in there that's not causing normal movement. We want the nucleus to be at the center of the joint to provide like a ball bearing for spinal movements. And if it's not in its proper position, if it's not moving properly, it can cause that obstruction. Other parts or other components of a joint obstruction could be a loose body or a space occupying fragment in the knee. Think about a piece of cartilage has broken off and is floating in the knee and causing joint obstruction in the knee, a piece of meniscal debris, something from a meniscus tear. You can also have joint obstruction if a bone fragment is in the way, or inflammation is space occupying. So like I said, there's subcategories for all of these, and as a clinician, I think about first kind of figuring out what the big issue is, and then subdividing it and finding out, if we need to, what is actually causing that obstruction, what is actually causing that tightness or restriction of joint mobility. So if we can't go there, it could be tissue restriction on the right. Then that begs the question, well, why did the muscles on the right side of the neck get tight? If the person wasn't in a neck brace or immobilized or had some plausible cause, I think we need to really question that narrative. Muscles getting tight, to me, there has to be a plausible cause why that muscle got so tight that it's restricting joint mobility. So then, if we look at the other motions, there are 8 motions of the neck, of course. If the patient goes to the right and we're putting tissues on the left side on stretch and remarks that that is painful, or the clinician or the patient notes that it is not moving as much as it should if it's limited, then if we want to blame the tissues, now we have to blame the tissues on this side of the neck. So then the paradigm for the patient in front of you becomes they have tissue tightness in the right musculature and in the left musculature. That makes it even more implausible if there's not an obvious immobilization or other cause for tissues to become tight. Now, if we look at the other motions, and there's 6 others, and they're also limited and or painful, we really need to rule out in most cases that it's tissue related. Yes, in the extremity joint, capsules can provide kind of multi-directional tightness, but it's not very common to see something like that in the spine. There is not a capsule around the vertebral joints like we have in the spine or in the extremities. There are capsules around the facets, but they don't provide the same type of role. So if there are multiple planes that have lost range of motion or have painful range of motion, especially pain in different spaces, in different places, I'm not thinking it's a tissue problem in the neck. But it could be joint obstruction. Something's not moving well, like I said, in that vertebral unit, maybe within the disc, maybe outside, more in the facets, but the joint's not moving well, and so it's presenting that it's not moving well in several planes. Joint obstruction typically, in my experience, is going to obstruct motion in more than one plane. If we go back to a knee example, if you have a bone fragment or a fragment of a meniscus or cartilage sitting in the middle of the joint, it's likely you're going to have problems with getting end range extension and end range flexion in a pain-free manner. The same thing happens with the neck. We have 8 planes of motion in the neck that I check: side bending left and right, rotation left and right, retraction and extension, protrusion and flexion. If multiple planes are limited and or painful, then I'm starting to think it's a joint problem. And I'm starting to think there's an obstruction to movement that's prohibiting normal pain-free movement in more than one plane. Another common example, people are always taught to stretch to one side because they need to stretch this tissue. Again, I don't find that. People are also taught to stretch down and to one side, to stretch the levator on that side, but the same premise applies. If that's not restricted, if that's limited in another direction as well, then it's probably not the levator. And as I mentioned before, to me, I'm always thinking first there's one orthopedic problem before there's more than one, or there's one diagnosis before there's more than one. So say the person has limited and painful mobility going down and to the left, and so you're like, oh, the levator is tight, we need to stretch that. But then the person also has limited or painful extension when the levator is on slack and not on stretch. Then some clinicians, I think, start to think, well, you have a tight levator, but you also have XYZ. And again, I don't think we're going to jump to it's 2 problems before it's 1. If you have difficulty with flexion and rotation looking down, and you have poor extension, like I mentioned in that example, I'm thinking there's something not moving well in the joint. And the goal would be to investigate, is there a movement or 2 that we can do repeatedly that gets that unit, that joint unit, whether it's C4 on C5 or C6 on C7, operating, mechanically functioning well again so that movements in all planes resolve. I see this problem not only in the neck, I see it in almost all joints where people want to blame tissue. And again, and I can get into the specifics, I'm not going to now, but there are so many things other than the kind of easy ones I mentioned now with the neck that rule out tissue restriction as the problem for limited joint mobility. The problem is I don't think people are thinking about joint obstruction. They think about joint obstruction when they think about, yes, fractures or inflammation after a surgery can be obstructing movement because it's taking up so much space in the knee after a knee replacement, for example. But they're not really thinking about joint obstruction as a mechanical problem that's solved with a mechanical solution. We are not going to fix the inflammatory problem very well with movement, although gentle movements and time can be a treatment for inflammation, but sometimes obviously you need to aspirate the knee or treat it with oral anti-inflammatories. That space occupation, like I said, is more understood for joint obstruction. And the bone fragment moving around is not really going to be fixed most times with movement. But mechanical problems where the nucleus is not moving well, the annulus is not loading like it should, or maybe something that we don't understand, a small piece of soft tissue debris in the extremity, for example, maybe these problems that I call mechanical can be fixed with moving in a very specific direction. For the necks, if there's a mechanical problem in the neck, and that's a large majority of neck problems that I see, the most common movements that fix these problems are moving in directions that people don't move into on a regular basis. It's moving repeatedly into retraction extension, or extension, sometimes in sitting, sometimes in prone lying, sometimes in supine lying, sometimes on a repeated basis, sometimes on a sustained basis throughout the day. There are different protocols for the individual patient based on how their joint responds specifically to mechanical loads. So please consider that outside of tissue tightness causing a lack of range of motion, a big piece of the puzzle for me is joint obstruction. And if that joint obstruction can be fixed with specific movements in specific direction, with specific loads, I call that a mechanical problem. If there's something obstructing joint motion and it cannot be fixed with movement, then I think of that often as a structural problem, and another type of treatment would be indicated. But mechanical problems, joint derangement, per Robin McKenzie's definition, is defined as being fixed by moving in a specific direction repeatedly. So if you have limited motion here and limited motion here, and we do repeated retraction, and both of those normalize, and those are the only 2 signs, for example, other than the symptom of pain, that would fit the definition of a mechanical joint derangement per Robin McKenzie's principles. And that's something I find on a very regular basis. So be cautious when you just want to blame tissues.